Hi, Dr. Alina Kolchitsky, Boutique Bodyworks. Today I'm going to do exercises for the hips. So we want to both mobilize and strengthen the hips. These deep muscles around the hip bones are important to support your pelvis, which helps support the spine. The pelvis is like the saddle for the spine. So for standing activities, anytime you're on your feet, those muscles, their ability to move through range and to have enough strength to support while we are doing activities we ask of them is important. So there are a million exercises you can do for any particular area of your body, but I want to give you just a few to minimize your time and maximize the effect. So let's start with the strengthening exercises. So you can lay down on your bed or you can lay down on a mat on the floor. We're going to position ourselves on our stomach and hand over hand, resting your forehead on your hand is the best way to keep a neutral spine while you exercise. When you're doing any kind of exercise on your stomach, you want to make sure that you keep the low back relaxed and do indeed work from your hips. The back is very strong, so it's going to want to recruit and take over for the job. But we don't want that because it's already strong. We're trying to strengthen the deep hip muscles and keep the work where we want it. So make sure that while you're in this position, you're pulling your belly button inward towards your spine and up towards the rib cage to help support your spine. And sits bones, those bones you feel when you sit on a chair, think of drawing them in and down so that your hips turn out slightly. That activates those deep muscles so that we keep this exercise in the body part we want and not in the back. Okay? So, again, hand over hand, resting your forehead. Let your pelvis settle. Just give it a little rock. I'm going to keep my head up so you can hear me, but you keep your head down for the exercise. So once you've let yourself kind of center your pelvis and relax, make sure you're relaxing your upper backs and no hunching your shoulders like so. Try to open up the neck. So think of your armpits, your rib cage funneling downward. So ribs funneling down and in towards your waist. Okay, so that's helping to stabilize from above the pelvis. So we're going to start with just bending one knee. You can flex your foot or just relax it. Either way is fine. But I have a 90-degree angle in my knee. So don't overbend it and don't underbend it. So just there in the middle so your foot faces the ceiling. You're going to rock outward and inward. We're just priming up the hip joint to try to move it into internal rotation of the hip joint, even though your foot's going outward, yes, and then external rotation of the joint. So notice that I'm going gently, slowly within my available range. I'm not trying to crank or force it. So once I've done that about 5 or 10 times, just depends how much time you have to be here, we're going to go into the strengthening part. So we start in the same position. I'm going to slide my knee along the mat and upwards towards my rib cage and then rotate back out. Notice how that knee angle stays at 90 degrees. And repeat. Come in and back out. Now if you're on your bed, you may not slide as well. So just think about that when you do choose a surface to do these on. Okay, so we're doing that 5 times. Let's do the other side. Bend your knee. We're going to go out and in. Yes, my pelvis rocks a little bit. That just depends how tight you are in your hip joint. Nice loose people, you won't see that happen at all. It's about 5 times. And now we'll prepare for the sliding out along the floor or mat, up towards my rib cage on the same side, and then back in so that my inner thighs touch and my foot's to the ceiling. And repeat. Then again, I'm trying to keep my back relaxed the whole time. Okay, good. Next, we're going to do both sides together. So our knees are together, feet are together to begin. Our knees are going to separate, slide up, and back out. Pull your belly button in, sits bones together. Keep trying to keep the ribs, shoulders down away from your ears. So open up your neck. So we're strengthening and mobilizing at the same time. And rest. If you have time, you can always do more things. So from this position, let's try lifting. We've got our knees together, feet together. My feet are bent or flexed. I'm going to lift just slightly and lower. Be really careful with this one that we're not recruiting the back. It's really hard to keep the back relaxed with this one. So squeeze the seat, and it's tiny. If I go too much further, my back wants to activate. So we're working the big muscles of the glutes. Okay, next we need to mobilize our inner thigh. So there's several muscles in that compartment that go into the groin. Tightness here affects back pain. It's also common with poor hip mobility, so we want to make sure that we stretch those muscles. So we're using our bed. You could do this on your bed or your couch, any elevated surface. Bring one foot up out to the side. That knee is straight, relax the foot, and now I'm going to bend my stance leg, bring my hands to the mat, and just rotate my trunk forward and rotate back up. Rotate forward and up. My back angle, just so you can see, is a hip hinge. So I'm not rounding my back. So careful that you're not doing this. Keep the back straight and then rotate from the hip joint. Just like doing proper squats. It's a hip hinge, okay? So you could use a chair. You could put your foot out on a chair to do this as well. So we'll do that several times, maybe up to 5. Now go ahead and bend that knee and stretch into it. Come back out and pull the toes up. And then bend this knee. We're going to bend the top knee. Go back, pull the foot up, straight knee, bend your stance leg. Stretching again through the inner thigh. So it's a nice flowing stretch. We're getting those inner thigh muscles, but also a little bit of hamstring, the medial part of hamstring, medial, meaning middle. Okay, next we're going to turn our body this way to get the lateral part of hamstring. A little ouchy for me, I'm tight there. So you're going to press the knee down and release. Just trying to floss the tendon of the muscle and the nerve, sciatic nerve that runs through our hamstring muscle. And now let's point and flex the foot. Good. And then we can add a hip hinge. Straight back, hinge, hinge. We can add, keeping that foot up, and hinge. Ooh, that gets the calf muscles too, which affects your knees. So this is good also for your knee mobility, because those tight muscles affect the knee and the hip and the back. It's all connected with the lower chain. Let's do the other side. So your foot comes up onto your bed, your chair, or your couch. We're going to rotate forward. That knee is straight. Rotate back. Straight back. I'm hinging. This knee bends a little bit to allow me to do that hip hinge, just like squatting, except you got your leg out to the side. Okay. Good. And now let's bend into it and come back and stretch. Bend, pull the toes up, bend the knee. Last time, pull the toes up, bend the knee. Good. Now we'll turn towards that leg Feel the stretch in the back of your thigh. Point and flex. We're just mobilizing that tissue back and forth. And let's go ahead and hinge forward. Let's add a knee bend. So see how I can just play with the different parts. I'm playing with the foot angle, with the knee, the hip hinge, and bending. All those different components can increase or decrease the stretch through the whole lower chain. So again, you can play with them. I can keep that foot on to create more stretch and bend and hinge. So now I've got maximal stretch. Minimal, maximal. You get the idea. And bring your leg down. And that's it. So we did strengthening and we did mobilizing, and you should feel nice and free now and like you're loose and ready to go. Hope that helps. Remember to check my other videos. Check the one for low back and for knee, because each joint is affected by the one above and below. So you want to take care of all of them. They're all connected. And I have a full program for every single part of the body. Thank you. Have a good day.